Governor Roy Cooper continues to tell us that he is making his COVID-19 shutdown decisions and mandates based on the science and the data. But John Locke Foundation researchers say that the public data that is being distributed by Governor Cooper's administration, it's lacking, it's incomplete, it's selective. Jordan Roberts is the healthcare policy analyst for the John Locke Foundation. He is one of the team members looking at all of this data. He joins me now with some questions, some unanswered questions about the data related to COVID-19 in North Carolina. Jordan, welcome back to the show.
Thanks for having me.
This is such an important discussion here that we provide context to the publicly available data, because every single North Carolinian is affected here, and there are just huge impacts on the economic well-being in addition to public health here in our state. Let's talk first about something that you've been looking at. Sadly, we know that in nursing homes in North Carolina, what's known as congregate living facilities, where folks are living together in a facility, we've had an incredibly high rate of infections and deaths in North Carolina. What don't we know that we should know?
Right. So, a question that a lot of us at John Locke have been asking, specifically my colleague John Sanders, is, did the governor and the Secretary of Health and Human Services mandate that nursing homes and other long-term care facilities take COVID-positive patients from the hospital? And, what we saw in other states, specifically New York and New Jersey, is that they did mandate this, and that's been a big topic of discussion now, looking back and kind of reevaluating, was that the right move, and did that cause excess deaths? And, what that question just hasn't been answered here in North Carolina. And what we do know is that about just under half of the deaths in the state have occurred at these congregate living facilities. And, it's kind of ironic when we think about, the way that these orders have been put into place, keeping us at home, keeping businesses shut down. You would think that somewhere like this, like a prison or a congregate living facility where everybody's kind of in place, would be one of the easiest places to keep the virus out of. So it's a question that we need to know, and right now we don't know any of the information about how the Health and Human Services Department and the governor's administration directed these hospitals and long-term care facilities. What happened there with the COVID-positive patients? And like I said, we know in New York that was a big cause of spreading the disease, and so many of those unfortunate deaths that happened in congregate living facilities.
In fact, Jordan, it was only recently, just a few days ago, that Dr. Mandy Cohen announced a testing plan for people living in these facilities and the people who are working there. Seems months late.
Right. And this is what a lot of, media members have been calling for this and asking, what is the strategy? What is our long-term strategy here? Because as we've talked about before, we kind of have a good idea of the profile of the care of the patients that get the disease, and the people in congregate living facilities and nursing homes are the exact high-risk category that we should be prioritizing. And yeah, you're right. Just last Friday, they announced that, there is going to be mandatory testing. Before it was, recommended, and there was one, I believe in late June, one randomized testing across the whole state, but now it's every 2 weeks mandatory reporting to HHS. And so, as we know, there's a lot of asymptomatic spread, so that recurring testing, keeping up with all the healthcare workers there and the patients is so important to keeping the spread down, because when it gets into these congregate living facilities, it just runs rampant.
So many unanswered questions about that whole segment of our population and just been devastated, not only by infections but deaths. You and the other researchers here at the Locke Foundation have also, for a long time, been looking at the issue of potential expansion of the Medicaid program in North Carolina. Some states have expanded Medicaid under Obamacare. North Carolina's legislative leaders, the Republicans there, have resisted that. They have other ideas about how to give people access to insurance and care. Governor Roy Cooper and Dr. Mandy Cohen are big-time advocates for expanding Medicaid. It's been interesting, Jordan, that recently Dr. Cohen, not at every news conference, but at many of them, has started to push for Medicaid expansion. What impact would expanding Medicaid have on COVID-19?
Right. Well, I think what she's doing is she's it's unfortunate. I think it's a little bit of political posturing here because this is a policy decision that the legislature has to make that decision on. And, I think the Republican leaders have made it very clear that, that's just not on the list of options for them. And so, while expanding Medicaid would provide some uninsured folks with coverage, it's an inadequate and, incompatible policy choice with the decisions that our state leaders are facing in terms of the budget, long-term fiscal sustainability, and just the simple fact that, like you said, we do have other tools. I have a piece out this week that talks about a state innovation waiver that the state could apply for and, really lower the premiums in our individual market, bolstering, when people don't get insurance from their jobs, they go to the individual market. So looking forward with so much loss of insurance from, the mandatory shutdowns and people losing their jobs that, that's where we should be looking to reform, not expanding and making commitments to long-term spending when we have, the shortfalls and so much uncertainty with how the state government operations are going to be in the future. So, like I said, it's unfortunate, and, I think it distracts from the message that, we have a serious issue in terms of health and economics and with the state budget, and, Medicaid expansion is just really incompatible with all of those.
Jordan, Dr. Cohen also apparently made a decision about a term that's hard to pronounce, but it's become part of our lexicon these days during COVID-19, and that refers to the drug okay, you're going to have to pronounce it for me.
Hydroxychloroquine.
Hydroxychloroquine.
Yeah.
There we go.
Yep.
Now, that has been in the news primarily because President Trump was talking a lot about that, took a lot of criticism about his views of that particular medication. Tell us about the nexus between North Carolina's Dr. Mandy Cohen and that drug.
Yeah. So what she did was, requested a rule that banned the use of this in the state, and it's unfortunate again because a lot of, with such a hyper-polarized world, a lot of your political party is kind of a predictor for a lot of things, and so obviously with the president promoting it, there became sort of this division over it, and I think that unfortunately affected a lot of the science and the way that the studies were interpreted. I think from what I've seen, the results are mixed right now at best. There's been a lot of randomized studies that show it can have an effect earlier on, and maybe not so much when the disease is more set in, but just here in North Carolina, Duke University is doing a massive randomized study on this, and what again, my colleague John Sanders has written about is that it can probably be used as a preventative tool for frontline healthcare workers, and it may be right for some patients, but that's a decision between them and their doctor, and just kind of this blanket, prohibition of the drug. It doesn't seem to make sense when, everyone's going to be affected by the disease differently, and so that may be the right decision for some people.
So, Jordan, let me make sure I understand. So, Dr. Mandy Cohen actually restricted the use of that drug in North Carolina?
Yes.
And do we know why or how she did that?
Well, I think it went through the board of pharmacy. They instituted a rule about the use of that, no emergency use. So
that really took away a doctor's ability to say, hey, I think this is appropriate for this particular patient, or maybe I don't think it's appropriate for this other patient. So it took away their flexibility to prescribe this?
That's right.